and her medical degree from the University of Alabama, Birmingham. She's been on faculty at UAB since 2016, and her role as healthcare epidemiologist focuses on prevention and the spread of the infections within the hospital. She also serves on the YMCA Medical Advisory Task Force. Many people see her as an expert in all things related to infectious disease. I want to allow as much time for this topic as possible, so with no further ado, it's really a great honor to turn the program over to our friend and advisor, Dr. Rachel Lee.
Thank you, Dan, and thank you for having me. I will say it sometimes is hard to say that I'm an expert in all things infectious diseases because I feel like things like this with COVID-19, we're constantly learning as things are changing. So let me just go ahead and pull up my slides. All right. And Dan, you can see my slides okay?
Yes.
Okay, great. All right, so just some disclosures and disclaimers. I have no relevant financial disclosures to this talk. The material presented here is really for information purposes only and may not necessarily reflect the views of UAB. And last, I will say I am an infectious disease doctor. I just came off of the infectious disease consultation service, so I am seeing firsthand what it's like for patients to suffer with COVID-19. So I do have that bias in mind. And so hopefully you will see some of the reasons why we are recommending what we're recommending in terms of vaccination and masking. So what's going on in the United States right now? Well, I will say that we are at a high level of community transmission, but luckily cases are slowly beginning to drop. If you look at across the board in the United States, red is bad, of course, and you can see that about 94% of the counties across the United States are still having high levels of transmission. If you compare this to the week prior, we were seeing much less of the red, or much more red. So I think this is a sign that things are starting to slow down. Our 7-day moving average of daily new cases has decreased by 12%, which is really good. All of this rate is driven by the Delta variant in the United States. So back in March of 2020, when we had that original COVID-19 strain, we've seen the development of these variants, and now we are seeing what's called the Delta variant, which WHO has been using these Greek letters to determine these new variants. The orange in these graphs right here are all Delta, and you can see how we've kind of started off back in the beginning of June with some Delta, and then it has completely taken over. In Alabama, we do sequencing at the University of Alabama at Birmingham, and about 94% are attributable to Delta. In the most recent weeks, nearly 100% have been attributable to that. This is potentially dangerous evolution of future variants in the area with high transmission rates. So we know that this is much more infectious, which means that it's easy to transmit, and it's much more harmful. So you can have higher severity of illness and hospitalization. One of the ways to think about this with the Delta variant is something called R0. So an R0 is the number that is determined how many people will become sick after one person is infected. So the most infectious thing that we have out there is measles by far and away. So one person can infect 18 people. With that original strain of COVID-19, it was about 1 to 3. And now we're seeing with this Delta strain that about one person can infect 7 people. That's close to chickenpox. So it is concerning because if you have one person that is very sick, they can spread it very quickly. With that spread of disease, unfortunately, we are seeing a large amount of hospitalization. This was a study that came out of the Lancet, and it looked at data from about 43,000 different COVID-19 positive patients. A vast majority of these were the Alpha variant, which is the surge that we saw around in January. And then about 8,000 were from the Delta variant. When they compared the two, Delta patients were much younger, on a median age of 29 years. And they had 2 times the risk of hospitalization. And they also used emergency department more than Alpha patients. So you can see how this can be very overwhelming to hospital systems, and it can be concerning to our friends and family, especially if we are young and we don't have very many illnesses, and that can put you at risk for being hospitalized. So what are we seeing in Alabama? Well, I think there's some hope looking at these graphs. This comes from the Alabama Reporter. I think seeing a snapshot of what we are currently seeing is very helpful. And so on the top, you can see the number of cases by day, and that is decreasing. So we are coming down, which is great. We are still having about a 19% positivity rate in our tests. So out of about 18 to 20,000 tests per day, about 1 in 5 will still be positive. And with that comes hospitalizations. So we still have a high number of hospitalizations, but we're hoping that this is peaking and coming down. It's much slower to come down. If you look, it's a wider kind of shape of a hill compared to what we saw back in January. And so with that, we have 772 confirmed patients who are COVID-19 positive or people who are under investigation in the intensive care unit alone. This is nearly 50% of all of our ICU patients in Alabama are COVID positive. So with that being said, I want to talk about COVID-19 vaccination. This is something that's very near and dear to my heart because I'm surprised and honored to see how these vaccines are incredibly effective in preventing people who have COVID-19. So what do we know right now on how to prevent the spread of infection? So we know that wearing a mask that covers your mouth and nose helps. We know that avoiding close contact with others or staying about 6 feet apart seems to help. Avoiding crowds and poorly ventilated spaces, washing your hands frequently, cleaning and disinfecting high-touch surfaces as necessary. And then last, getting vaccinated for COVID-19. I will say that people getting the virus that causes COVID-19 can offer some natural protection, but we don't know how long this protection lasts. The risk of severe illness and death from COVID-19 far outweighs any benefit of natural immunity. And COVID-19 vaccination will help protect you by building immunity without the risk of having severe illness from COVID-19. So before we talk about that, let's talk about what a vaccine is. So a vaccine is any preparation that is used to stimulate your body's immune response against diseases. We have many, many vaccines out there, and we have been of the benefit of having vaccines around that have prevented illnesses. So case in point would be smallpox. So you can ask my mom, who was vaccinated against smallpox. So people, in the generation prior to me were able to get vaccinated, and ultimately we have eradicated smallpox and the disease associated with it. So that vaccine is the preparation that we use to boost your immune response. The vaccination itself is the act of introducing that vaccine into your body. So we can give it through a needle. We can also give it through your nose, like the flu nasal spray, or you can ingest it, like with a typhoid vaccine. And then immunization is that process in which a person is becoming protected against the disease. So that's when your immune system is revving up and creating those antibodies. Where are we with COVID-19 vaccination in the United States? I think one of the most helpful things to look at in this table is the bottom. So we know, based on data that we've already had for 18 months now, that people who are older are at really high risk of having severe disease. And so the percent of the population that's over the age of 65, at least 92% have received 1 dose of vaccine, and over 80% are fully vaccinated. Now, you can see we do have a little more work to do with the age 18 and up. About 75% have received at least 1 dose, and 64% are fully vaccinated. And then when we bring in kids ages 12 and up, we have a little more work in terms of trying to get them vaccinated as well. Overall, if you look at our total population, we're only about 53% fully vaccinated. We have a large group of kids that have not been able to get vaccinated yet. Well, in Alabama, you can see we actually have had an increase in vaccinations. And so beginning around June, we've seen this uptick of vaccinations. This is all right around the same time that we saw this Delta variant coming around in Alabama. And so we are no longer last in the nation. And so 65% of our vaccines that are given today are actually first doses. So this is really incredible work. And if you've been reaching out to your friends and family about getting vaccinated, that work is very meaningful, and it is being shown here in these graphs. So one of the biggest questions that I received about these vaccinations is, how do we know that they are safe given that they happen so fast? And so I think it's important to realize that the timeline was sped up, but there were never corners that were cut in terms of safety and the research. It was really corners, or the stuff that was cut was the red tape that typically occurs with vaccination. So the cost of doing the research in the way that we were able to get that done is because the United States and other governments invested a lot of money to support the vaccine companies with their work. We already had helpful information about coronaviruses. We've had 2 other pandemics from coronaviruses. One is SARS, which occurred in 2003. And the other one is MERS, which is Middle Eastern Respiratory Syndrome. That occurred around 2012 to 2013. So we already knew a lot about these coronaviruses and where the spike proteins were. And so we weren't really starting from scratch. We were able to quickly identify that same spike protein when we saw SARS-CoV-2. The other thing is that mRNA vaccine platform has actually been studied for years. And while this is the first vaccine that has used mRNA platform, it is not very new data at all. We've been using it in other kind of research areas. There are a lot of people that participated in these clinical trials, and they also participated at times of high rates of infection. And so that allowed us to show efficacy very quickly. And then also manufacturing actually happened at the time as a safety study. So the vaccine companies took a risk and they went ahead and started manufacturing while we were waiting for FDA approval, so that when it was approved under EUA, they were ready to be distributed. So which vaccines are available? So we have the Pfizer, which is available for ages 12 and older. It's 2 shots that are separated 3 weeks apart. The Moderna is also an mRNA vaccine. That's 2 shots separated by 4 weeks apart. And then the Johnson & Johnson vaccine is for ages 18 and up, and it's 1 shot. Of these, the Pfizer vaccine is the only one that's been fully approved, and that's been fully approved for ages 16 and up. So you may be asking, how in the world do these mRNA vaccines work? And so what you can see here, so this spike genome is what we are trying to target here. There are these little spikes that are on the outside of the virus, and then this is the genome that helps create these little spikes. So we took the little nanoparticle, lipid nanoparticle, and put it around mRNA. So if you've heard the term nanoparticle before, it really is just responding to this little fatty layer that protects the mRNA. mRNA is very fragile. We are exposed to mRNA every single day from viruses around, and they disintegrate pretty quickly. So this lipid nanoparticle actually protects it when we are injecting it into our muscle cells. So once we have that injection into the muscle cell, the lipid nanoparticle will dissolve, and then the mRNA will come in, and our body will read that mRNA and turn it into protein. So you can kind of think of it like a computer that's reading an algorithm. From there, it creates those foreign spike proteins, and then they get put onto our muscle cells. Now, our body is very intelligent, and it recognizes anything foreign very quickly. And so once that is recognized, it is then presented to a T cell, which is a type of immune cell. And that T cell interacts with our B cells. So those are our memory cells. And those memory cells will then be there for a long time for protection. So if we ever see this SARS-CoV-2 again, those antibodies are ready to attack and destroy it. All right. And so that's what happens anytime that we get exposed again and again. Now, the Johnson & Johnson vaccine is just slightly different. So once again, we have that spike protein right here. And then that is packaged into an adenovirus. So that an adenovirus is a type of virus. It causes kind of runny nose and kind of upper respiratory symptoms typically. It's been modified so it doesn't have any of that infectious particles, but instead we just have the outside layer. Once that's injected, the same process happens where we get that mRNA, which then creates those spike proteins, and then we have our body making immune cells, and then that's when we have protection. So do vaccinations work? Do COVID-19 vaccinations work? And I think by far and away the answer is yes. But one way to think about this data is, we were trying to prevent severe hospitalizations and death with vaccines. And so if you take the 170 million Americans that are currently vaccinated, that leaves about 165 million Americans who are unvaccinated. So that's nearly a 50-50 split. If vaccinations have no effect, the death toll would be nearly identical between vaccinated and unvaccinated. So in the week of August 15th through 21st, we had about 5,500 people that died from COVID-19. And so if it were in the same amount of people who are vaccinated and unvaccinated, this is what that would look like, same numbers in terms of death. But what we're actually seeing is that most of the deaths are unvaccinated. Now, we have had some breakthrough cases that have led to death. And if you look at some of the disease, some of the issues in those patients, they're immunocompromised. And so that really is leading to a lot of people having severe outcomes after they've been vaccinated. Another way that you can think about the benefit of vaccination is that these vaccination rates actually can help control the spread of COVID-19 in our community. This is data from the CDC. I already feel like it's a little bit old because it was in July. It's funny when we're learning about COVID-19, some of the stuff already feels out of date, and it's only been a month. But you can see here that the percent of state population vaccinated was on the x-axis, and then the case rate per 100,000 is on the y-axis. And you can see that the lower your rates, the higher your 7-day case rate. A lot of this is spread by the Delta variant, so that high amount of virus that's there. But in these states that have much higher rates, you see much lower 7-day case rates. So I think that's really good data to show how we can help control the spread of COVID-19. So there were some questions that were already submitted prior to this town hall. I'm going to go through those questions, and then we'll open it up to any questions that are in the Q&A. So one of the biggest questions that I have received is, I want to have a baby one day, and is it safe for me to get a COVID-19 vaccine? The answer is yes. Unfortunately, there's a lot of misinformation about fertility and the COVID-19 vaccine. And there have been studies that have been done that have proven that there's no effect in your fertility in either men or women. And so I think experts know that these COVID-19 vaccines are safe. And for someone who's trying to become pregnant in the short term or in the long term. So if you have a child who's 12 and they want to be pregnant one day, this is not going to affect them in any way. Can someone who is pregnant or breastfeeding get the COVID-19 vaccine? The answer is yes. The American College of Obstetricians and Gynecologists have enthusiastically recommended that COVID-19 vaccines be offered to pregnant and breastfeeding individuals. We actually have recent data with thousands of pregnant women that have had very healthy babies after vaccination. And we know that people who are infected with COVID-19 and are pregnant and not vaccinated are at increased risk for having severe complications. At UAB, we have seen a lot of severe complications in young, healthy, but pregnant women, and that's what we want to prevent. We do not want to see anything happen to these moms or to be and to their babies. And in addition to this, the vaccines are safe and effective for those who are breastfeeding as well. Another common question that I have gotten is, will a COVID-19 vaccine change my DNA? The answer is no. COVID-19 vaccines do not interact with your DNA in any way. If you recall the image that we showed of how the vaccine works, those mRNA vaccines do not enter your nucleus, and the nucleus is where your DNA is housed. So it doesn't come into anywhere near your cellular DNA. And then the Johnson & Johnson vaccine does enter the nucleus to kind of break down and then go into mRNA, but there's no way of interacting with your DNA. It only uses the systems inside of our nucleus to make that mRNA, and then the mRNA once again leaves and makes spike protein outside of the nucleus. So I think this is a great question. Will the vaccines work against COVID-19 variants? Viruses can mutate as they spread, and then when that spread happens, new variants appear. What we typically see is the process of creating new virus within our cell is a very messy process. And with that messy process, you can get these new variants. And so this is one of the reasons why we recommend vaccination. But right now, because we're having such high community spread, we also want to mask to protect ourselves and to protect others. I will tell you that vaccinated people exposed to COVID-19 are 5 to 8-fold protected from infection, but 25-fold protected from severe infection requiring hospitalization and from death. This data was recently shown in an MMWR from the CDC, and you can see that this is data in New York, and among fully vaccinated people, the vaccine was 90% effective against hospitalizations. And then when they looked at from March to July, which is when they were starting to see that Delta variant, they saw an increase in COVID-19 infections. But overall, you can see that the effectiveness really remained, even if you were over the age of 65. So there was a slight decline, though, from 92% to about 80%. But they also thought that this was due to Delta because of that high amount of virus. And then also this relaxation of masking and physical distancing that occurred at the same time. So if you've already had COVID-19 and recovered, do you still need to get vaccinated with a vaccine? I would say that this is probably one of the hardest questions to answer, mainly because there's not a lot of data. I would say, that by far and away, the answer is yes. And the reason before that is we have a lot of unknowns around natural immunity. We don't know how long you are protected from getting sick again after you've recovered from COVID-19. We also don't know who will develop antibodies. In a recent study from UAB, 30% of people who had COVID-19 did not develop antibodies at all. And it wasn't predictive of someone who was asymptomatic or not. It just was 30%. So I can't tell you right now if you've had COVID-19, if you have enough antibodies to protect you. There are also studies that have shown that vaccination after people who have had and recovered from COVID-19 does provide a strong boost in protection. So I think there's great data that shows that getting the vaccine is safe and effective if you've had COVID-19. And then it also helps boost your immune response. So some of the other questions that we received was, what is the risk of exposure to COVID-19 while exercising in an indoor pool without windows? I will say that exposure and ventilation is very complex. And so there are some key things to think about when you have indoor exposure. So how many people are in the room together? Who's masking and who's not? Is anybody vaccinated? What is the space like? Is there natural ventilation like windows? And if there aren't, what about mechanical ventilation? What about your AC? And how does that air flow and move throughout that room? I think to answer the question, I do not know about the ventilation at the different YMCAs, but some of the things that you can think about is if you're exercising in an indoor pool, how many people are around there? Typically, those large indoor pool areas are very large to accommodate those pools. And so as long as there's not a huge number of people there, and during a time when we're having high community rates, you should be protected as long as you are distanced from one person to the next. So what qualifies you to receive a booster shot and how do you get it? So I think the data out there is a little bit confusing, right? Because as we started talking about boosters for the population, we were also talking about getting a third dose for people who are immunocompromised. So I like to tease those out to make sure that people understand those a little bit better. And people who are immunocompromised, and you can see the list right here. So active or recent treatment for cancer, you've had a solid organ or stem cell transplant, you have some sort of primary immunodeficiency, if you have advanced or untreated HIV, or you're on some sort of active treatment with steroids or some of these other medications, And even people with chronic medical conditions such as asplenia or chronic renal disease, you may qualify for a third dose. So think of it more like completing your vaccine series. That third dose should happen 2 months after the second dose. And you can go to any sort of Publix or CVS, Walgreens, et cetera, and say that I need to get a third dose, and they will ask if you meet these criteria, and then you just answer it, and they can easily give it to you. The FDA is reviewing the need for boosters after 8 months for adults who are not immunocompromised, but this has not yet been approved. So should I continue to avoid routine medical care, such as going to the dentist? So routine medical care, I think, is very important. And all clinics and hospitals right now are requiring to have masking guidance for patients and healthcare workers. So you can know that in medical clinics, we are following guidance from CDC and CMS. If in the setting of a dentist where you're not wearing a mask, but everybody else is, I think you can reduce your risk of exposure by wearing a mask in the waiting area, ensuring that your provider is wearing a mask. Getting vaccinated, of course, is a way to be protected. And if you're really concerned, like maybe you have to have a prolonged reason for needing vaccination or for needing some sort of dental treatment, you can wait until the community rates begin to decrease so that you can help protect you. So does receiving a whooping cough vaccine have any effect against COVID? So the answer is no. So whooping cough is pertussis, and pertussis is actually a bacterial infection that can cause a very infectious pneumonia. And so, you know, you get that classic whooping cough that's associated with it. And so you can see here, this is the vaccine series that you typically get when you're older. So you need to get Tdap with each pregnancy, and that's the one that has pertussis. And then you would get it after wound management. So if you stepped on a nail or if you had a piece of broken glass that cut you, something like that, we typically get that. Otherwise, you would get a booster every 10 years. Unfortunately, none of these will protect you against COVID-19 except for the COVID-19 vaccine. All right, so this question came in today with President Biden's announcement regarding vaccination mandates for employers with over 100 employees. Do you have any best practices that you're seeing within Birmingham companies to either encourage or mandate vaccines? So for me, you know, mandates, we all struggle with mandates, right? Because they're hard to implement. But I think education is the key. There's a lot of misinformation going on around there, and people are truly concerned and have questions. And so I think town halls like this are really helpful to hear those concerns and to try to address them. The goal of any mandate is to try to get us out of this pandemic. And I think we can all agree how exhausted we are with dealing with this pandemic at this point. And the United States is currently leading in deaths, so we have to try something in order to improve that. You can try incentives. I know that UAB is giving incentives for vaccination. There are people that have done penalties, you know, like the NFL, I believe, is doing penalties. I always find that those typically are harder. Maybe it's just because I'm more Southern, and I believe in trying to educate as much as I possibly can. So my husband and I received their second dose of Pfizer vaccine in April, and our 48-year-old unvaccinated son has recently moved in with us. We are socially distanced when in common areas, and unfortunately, he refuses to get vaccinated. So what would you say the risks are with having someone in your house? I think people struggling with this question and have people in their family that are disagree with you in terms of vaccination is very hard. It really puts a lot of strain in being able to see people and to care for our loved ones. And so I'm sorry that you were in this position. What I would say, if you think about it, we tend to go back to what we were doing pre-vaccination, right? How do we protect ourselves while still being able to see our loved ones? And you can think of it as a bubble, right? So you can say, hey, if you're going to be living with me, you know, I'm going to request that you wear masks when you're outside of this house. When you're here in the house, then you can unmask. And so that would reduce your risk as well. Hopefully, as these rates go down, then we'll be able to continue to see one another when we're fully vaccinated. So these next two questions, I think, are probably going to be the hardest questions because the tone of the questions in both of these are coming from people who truly care about their kids and want the best for them. So the first question is about disagreeing with putting children in masks and the belief that it's detrimental to their health and well-being, and what is the scientific data on this. And then the second is someone who had received notification that they were exposed, that their child was exposed to someone, and they were requesting quarantine that the CDC recommended, but it was not required. And so what do you do in those settings? So I will say that I have two children who cannot get vaccinated right now. So I have a 6-year-old and a 10-year-old. And so the concerns for them being exposed to COVID-19 are just like everybody else. I think this data is some of the saddest data that we have in Alabama right now. We have a total of 8,428 cases of COVID in children right now. Now, this is slightly down from last week, which had 9,195 cases reported, but that's still incredibly high. So we have to do something to protect our children from getting COVID-19. When you look at where the data is for mask wearing for respiratory viruses, I will say there's not been a randomized controlled trial of masking in the setting of this pandemic. And frankly, that's unethical, right? All we have right now are masks for people who are unvaccinated. We now have a vaccine for people ages 12 and up. But it is really, really difficult to do a randomized controlled trial during a pandemic. So what do we have instead? Well, we do have a lot of reviews, Cochrane review of 67 studies and randomized controlled trials of respiratory viruses that are spread in a very similar way. And by far and away, when you look at this diamond down here, this summarizes all of the data from these different studies. And you can see that N95 respirators and surgical masks were consistent and comprehensive supportive measures to prevent the spread of respiratory viruses. In fact, the N95 respirators were non-inferior, meaning about the same as surgical masks, but they are more expensive and, of course, uncomfortable. Now, during this pandemic, we do have epidemiologic studies that have shown where universal masking has been able to reduce the risk of COVID-19. And you can see here, we have the classic hair salon story from Missouri, where there were 139 people that were exposed to 2 symptomatic stylists, but everybody was wearing masks and there were no infections. Additionally, we have self-reported people who were masking, and that reduced the risk of infection by 70%. So you can go down this table and see how much your risk is reduced by wearing a mask. Now, is it 100%? No, that's why we have all these other mitigation measures to be able to protect us. And given that kids don't have vaccine, by far and away don't have vaccination yet, this is what we have to help protect them, because we do know the detrimental effects of having our kids in virtual learning and being quarantined and being sick. There is true measurable effects with that. But all of the data around masking in children, it is safe, it is effective. There was a study that was put out in JAMA that said that they retained CO2, and it was immediately pulled because the data was wrong, and a lot of it was falsified. The other data behind the Delta variant is that it can easily spread in indoors. Once again, it goes back to that high amount of virus. And so this was a teacher that was occasionally unmasked. She would take her mask down in order to talk to the class. And she worked while infected for 2 days. And you can see as she projected down her class, 12 out of the 24 kids were infected. And this is what we want to prevent, right? Because this means 10 days of not being able to be at school with other kids and learning in person because of one person who took down their mask. And then, a sobering thing with this is that we are seeing an increase of hospitalizations for children. So since the rise of the Delta variant, we've seen a 10-fold increase in hospitalizations among ages 0 to 4. And unvaccinated adolescents are 10 times higher likely to be hospitalized compared to fully vaccinated. So if you can think about anything and care about your kids, you know, I think this is some of the data that is very strong about why we are recommending hospitalizations. This hopefully will prevent the quarantine that that second person was having to talk about that may be required if you have exposure. So I think that's all I have for right now. I want to stop sharing and then I'll let us go through some of the questions.
Great. So Dr. Lee, one of the first questions is, what is the wait period to get vaccinated if you have tested positive for COVID after receiving your first shot, but not the second shot?
So if you are out of your infection window, so about typically 10 days for people that don't need to be hospitalized, you're feeling better and you didn't receive any of the monoclonal antibodies, then you should go ahead and get vaccinated with your second dose. If you did receive those monoclonal antibodies, we typically do recommend waiting 90 days.
Okay. The next question, are pregnant women considered immunocompromised even if fully vaccinated?
So I would say no. You know, there's always some data out there that when you have a baby incubating in your body that, you know, a lot of your resources, your immune cells are going to helping that creation of that baby. And so, but it's not in the same sense that we see with immunocompromised patients like what I described, like a solid organ transplant. In our data, you know, we've recently reviewed UAB's data of women hospitalized with COVID-19 and all were unvaccinated. And so I think that data just shows it's still important to be safe and still continue to wear masks if you're vaccinated, but I wouldn't consider you in the same group as needing a third dose for vaccine.
Okay. The next question is a comment and a question. This is a really great presentation. Dr. Lee, in your research, have you seen any advancements made that will allow COVID testing to be done without having to use a nose swab?
Oh, that is a great question. I think that nobody likes the nose swab. There have been some oral studies. I think actually some countries do use an oral swab and have been approved for that. It may not get nearly as much virus as the nose. So I don't know if they've made adjustments to be able to do that. We've also looked at like a spit test, but I will tell you the spit test is not very comfortable. It's like a large amount of spit to be able to do that. But I agree with you. I think if we could find better ways of safely testing and testing more frequently, that would help prevent us having to go into quarantine. And you can kind of get an idea of what's going on in your community.
And the next question is, how long is the vaccine effective?
So we are still learning that. I think right now we've seen that one, and it goes back to what are we measuring as effective, right? So the effectiveness of hospitalization and death has been maintained for all of these vaccines at 8 months and longer. Because I think a lot of our B cells that we have, those memory B cells, will come into play even if we are exposed. Now, mild to moderate COVID-19 breakthrough infections, this is data that we don't know yet. I know people have probably heard about people who are fully vaccinated and getting breakthrough infections. And so we don't know if it's because the high amount of virus that you're exposed to, and maybe it's just not enough to initially get over all of that virus that you're exposed to. But it at least looks like from a death and hospitalization standpoint, it maintains for 8 months, and we'll get more data as the year goes on.
Great. So the next question is, can you provide context for the recent Israel study that shows that natural immunity provides 27 times more protection than vaccination? I'm curious what to make of that data. I'm vaccinated, just trying to gain more info.
Yeah, so that was a preprint that came out. Preprints are like the bane of researchers' world because it's exciting to see the data, but it's not been peer reviewed yet. So it's hard to know what they use to measure between natural immunity versus the immunity that's from vaccines. So I have not read the preprint, so I'm going to go ahead and say that, so I can't fully digest it for you. I think there is something to say that in people that make natural immunity, I think that we can trust that that is a good thing that can protect you. And I'm hoping that we'll have more studies that can tease that out and really give us an idea of how can we measure what we need to protect us. And maybe that will be data, but it's interesting that in that study, it said that it was better than vaccines, which goes against a lot of the other studies that are out there.
Okay. The next question, are certain COVID tests more reliable than others? Should we be requiring our employees to have the PCR test versus the rapid?
So the PCR test is more accurate, but that with that cost comes time, right? You have 24 to 48 hours in order to be able to get that information. So in someone who has symptoms, the antigen test is really good because it gets you an answer in 15 to 20 minutes. It's cheaper and it's easy to do. Especially you can have it in office settings, and especially as we're thinking through what this mandate will mean to some of the businesses out there, you know, having an antigen test that you can use for people that may not want to be vaccinated is what would be the easiest thing to do. In the hospital setting here, we actually use both. For people who are symptomatic, we'll test them with an antigen first, but then we'll confirm it with a PCR test. And then if they're not symptomatic, we just do the PCR by itself.
Okay, and I know we're getting close to time, so I'm going to try to get a few more in there. Thank you for offering this town hall. If my children are masked, but they're around children who aren't, how protected are they?
I think if both people are wearing masks, both children are wearing masks, and nobody has any symptoms, they should be pretty protected. You know, my kids go to Highland School. And what we have seen, of course, like other places, we unfortunately have had a couple of cases, but when we look at the people that were wearing their masks at the desk around them, no one has gotten COVID-19 from that. I think that is very strong data to show how well masks work. The moment we take off our masks is the moment that we see spread, and that's what happens in our hospital as well, when we kind of drop our guard and do that. So, you know, as a mom, I think a lot about what is important to the mental health of my kids. It's important for them to be around kids that they know and that are their age. That's important for that social aspect. So how can I provide that in a safe way? So we can hang out outdoors. We'll wear masks. You know, right now we're not having people over to our house just because the community rates are so high. But once that comes down, you know, we'll once again try to hang out outside and enjoy that time.
Great. What is the best website for real-time guidance on COVID?
Yeah, there is a great website, depending on what type of person you are and what type of data that you want. There is the Infectious Disease Society of America, IDSA, has really great COVID guidance out there. All the up-to-date treatments, including, you know, my favorite, ivermectin. There's a lot of information about all those different studies that are out there. And, you know, what are the pros and cons for some of that stuff. Now, I joke about ivermectin, but there is a lot of lacking research about ivermectin right now, but unfortunately, it's being used incorrectly in our community right now.
If you're to test positive, what is your recommendation of what to do? Vitamins, prescription meds, quarantines? It seems like different doctors do so many different things.
So number one, quarantine. I think that's the easiest thing. We don't want to spread it to anybody else. Vitamins, to me, you know, they make you feel better. If they make you feel better, take them. You want to stay hydrated. We really don't have a lot to offer for a treatment for COVID-19. Now, there are a certain group of people that may fit the definition for getting what we call monoclonal antibodies. So that's like antibodies that will help kind of destroy the virus that are in you. And that's typically for people over the age of 65, or if you have certain comorbidities, including obesity or hypertension, or if you have immunocompromising illness of some sort. So that is something to think about. I do not recommend steroids. And in fact, if you are not having problems breathing and you don't have low oxygen levels, steroids may actually be detrimental. So the vitamins should be fine to take, and rest, of course.
Our next question is, I'm a breast cancer survivor. Are breast cancer survivors considered at risk and need the third dose of the vaccine? And do hormone blockers increase that risk?
Yeah, so I think you're hitting the nail on the head that we have a lot of missing data. And so I would say if you recently received chemotherapy, yes, you should get a third dose. Those blockers, it shouldn't be part of that, but at the same time, if you're concerned, ask your doctor and say, do I meet the definition? And they will tell you. And then you can just go down to CVS and get that third dose.
The next question. I have type 1 diabetes, cystic fibrosis, and suffering from kidney disease while on dialysis. My husband's had the vaccine and I had the J&J, but he does not wear a mask anywhere. Should I wear a mask around him, although we sleep in the same bed?
Yeah, I wonder if you could ask your husband, given that we're having such high rates of disease right now in our community, if you could wear a mask around others. That's one of the main reasons I trust my vaccine. I have no health problems. But this one of the main reasons why I wear it. My husband is also a type 1 diabetic, and I have 2 children that are not vaccinated, and I have older parents that were around frequently. So I want to protect them as much as I want to protect myself. So if you could ask him to wear that, I think that would be helpful. In the bed, it's really hard to wear a mask, but if he's unwilling, given these high rates, it may be helpful to wear a mask around him while we're having such high rates in our community.
The next question, if vaccinated people are exposed to someone with COVID, should they quarantine? And if so, for how long?
So no, luckily the CDC says you do not need to quarantine if you've been exposed to someone who has COVID-19. However, they do recommend testing kind of around the day 3 to 5. We have seen a fair amount of people who live with, children that may have COVID-19 that unfortunately they get it because, as a parent, it's really hard to stay away from your child that may have the illness. And so try and get tested around 3 to 5 days, and that will give you better information if you were truly exposed and need to quarantine.
Okay. Do the tests test for COVID or viral load?
So the PCR test checks for viral load, which is our correlate to an illness. And so you may have heard in the community something called a cycle threshold. So PCR will cycle in the machine, and how many times it cycles, it will determine whether or not they pick up virus. So a low cycle threshold indicates a high amount of virus, whereas a high cycle threshold would be much lower. So with Delta, we're seeing very low cycle thresholds, like around 20. And then people who've had it and then they're getting over it, it'll be closer to 40. The antigen test is actually picking up something that's active on the virus itself. And so it's really good in the first 5 days of symptoms, but it will go away very quickly. So that's where we can see some of those false negatives with the antigen test.
Okay. And I think we have time maybe for one more. Is it necessary to wear a mask indoors when fully vaccinated?
I have been, given our community rates, if I'm in with a lot of people in a room that is required for my job, then I definitely wear one. And currently I've been wearing one just out of respect to everybody around my office. So I work with a whole bunch of infectious disease doctors, right? So everybody's vaccinated, but we are still masking up in our office out of respect to one another. And because of, we don't want to bring anything home to our kids or to our loved ones.
Dr. Lee, we just are so grateful for you taking this time to spend with us and to answer such questions with just such intelligence and in-depth answers. And so we're grateful for everyone for participating in the conversation in the town hall as well. I'm going to put my email back up on the screen. Dr. Lee has been awesome at answering questions, and she's opened herself up to, if you would like to send a question to myself, I can get it to her to get an answer for you guys as well. But we as a YMCA are just honored to have such great experts around us with UAB. And we are committed to the health and wellness of our community, and we're just so thankful for this. We have recorded today's conversation, and it is going to be shared out on social media as well for everyone to share with people that might not have been able to participate in today. But once again, Dr. Lee, we're so appreciative of you being here for us today.
Thank you. And I just want to let everybody know there's never a dumb question in my mind. If you have questions or concerns about something, that you've heard, we are here to help. And so please send them to Jude and he'll reach out to me.
Thank you, Dr. Lee.
Thank you.